Hello, my name is Rebecca Perl, and I am a Vice President of Partnerships and Initiatives at Vital Strategies. We are a global public health organization dedicated to tackling the most difficult public health issues, from preventing epidemics to fighting the leading causes of disease. Harmful use of alcohol feeds into those diseases and is a public health problem that requires a population-wide focus, but it's not always addressed in that manner. I'm going to talk about a policy report that Vital created on this issue as part of a series of reports on non-communicable diseases, also called NCDs or chronic diseases. And then I'll turn the floor over to my colleague, Nandita Murukutla, who will speak about a second report on alcohol subsidies. This presentation will be about 20 minutes long. Next slide. I'm just going to give you a minute to read this slide. I have worked in tobacco control for much of my life, and while tobacco is an insidious problem, it's a product that kills 1 in 2. It doesn't disrupt societies in such a violent and acute way as alcohol. I also want to say, as you may know, that the harmful use of alcohol, most commonly referred to in the US as binge drinking, is a growing international issue and one that has unfortunately become worse during COVID. Next slide. The World Health Organization estimates that globally about 3 million people die each year as a result of harmful alcohol consumption. More than half of these deaths are from non-communicable or chronic diseases such as cancer and heart disease. Many millions more suffer as a consequence of their own or someone else's alcohol use. Alcohol, as mentioned, causes violence, injuries, and child abuse, and it plays a role in susceptibility to diseases such as tuberculosis and COVID-19. The economic toll amounts to hundreds of billions of dollars each year. Next slide. Alcoholic beverages have been produced and consumed by humans for millennia. Alcohol is also considered by many societies to be central to celebrations and social cohesion, to weddings and baptisms and other rites of passage, even to cementing deals. But despite being a leading cause of NCDs, alcohol's burden remains a low priority among countries. And unless alcohol policy is given more attention, the harmful use of alcohol and its consequences will continue to grow. I think one of the reasons the urgency is missing is that while many people who are well educated and in positions of power, perhaps like yourselves, or who work in public health, look down on tobacco and unhealthy foods such as McDonald's or soda, but they still appreciate cocktails and wine with dinner, and this colors views. Next slide. Just to talk a little bit more about the burden. 1 person every 10 seconds dies as a result of alcohol-related deaths. Alcohol is the leading risk factor for premature death and disability for people between the ages of 15 and 49. And youth who start using alcohol before the age of 15 are 6 times more likely to develop alcohol dependence or use alcohol in unhealthy ways later in life than those who start to drink at age 21. Next slide. A couple more key messages, some takeaways. So it's important to spell out that the economic costs of alcohol dwarf any positive economic contribution. And many societies are many communities and societies are unaware of the scope of alcohol's harms, especially the disease burden due to cancers. When it comes to cancer, there's no safe level of alcohol consumption, and we're realizing this more and more. Next slide. I want to speak a little bit now about the alcohol industry and its tactics. The alcohol industry has the financial and political power to block and derail sound public policies that threaten its profits. And across the world, the alcohol industry uses aggressive marketing tactics that can encourage harmful alcohol use and has drowned out public health messages. voluntary self-regulation of alcohol marketing, which is an industry favorite, is not a substitute for legal regulation. Next. Now, this is not a case of a few bad actors that we're talking about. Yes, there are some local breweries and cideries that in different communities, like in Oregon, but like the tobacco industry, the alcohol industry is dominated by a small group of multinational companies that control more than half of the world market. And the alcohol industry uses advertising rather craftily to accomplish two main goals: to lure and recruit new and young customers, and to normalize and promote alcohol use in new markets and increase global consumption and profits. Next slide. I'm going to keep returning to tobacco themes here because they're relevant for the alcohol industry, because they use a similar playbook of tactics to the alcohol industry. For instance, they use sophisticated million-dollar marketing that's often geared towards youth. They promote self-regulatory systems and voluntary codes like drink responsibly campaigns or get a ride home to head off legal regulation. They target poor and young populations in developing countries where legal policy to control use are often lacking. They also fund and publish pseudo and false science. They use front groups and trade associations like restaurants and hospitality to make their arguments. They employ huge lobbying operations to undermine policy, and they use corporate social responsibility to win favor, encourage goodwill, and discourage policy. Next slide, please. Now, I want to talk about some particular populations. When one starts to drink is important. As mentioned before, youth who start using alcohol before age 15 are more likely to develop alcohol dependence. And there is a real concern that youth alcohol use is commencing earlier, as young people are being targeted more by sophisticated alcohol advertising campaigns and new products that are quite appealing to them. Next slide. Young people are particularly susceptible to alcohol messages because, frankly, they often lack the control, judgment, and cognitive maturity to understand the sophisticated ways that advertising is manipulating them. Alcohol advertisements create false expectations about how alcohol will make people feel and be perceived. Advertising promises, for instance, those things that are important to young people: being happy, glamorous, successful, brave, fun, popular, sexy, hip, and liked. And all this advertising serves another purpose too. It normalizes alcohol use everywhere, from sporting events to any kind of social gathering. Next slide. Let's talk about women for a second. Traditionally, women in most cultures do not drink, but advertising targeting women has proven successful. And as a result, alcohol use by women, especially those of higher socioeconomic status, is catching up to alcohol use by men. Now, they say that women who drink like men will die like men. But alcohol may have an even more negative effect on women than on men, because women's bodies are generally smaller than men's, with more body fat and a different physiology that makes them more prone to brain, heart, and liver damage from alcohol. Consumption of 1 drink per day increases the risk of cancer in women by as much as 10%. And breast cancer is among the cancers linked to alcohol, which there are at least 7. The industry also targets LGBTQ people and minorities. Next slide, please. So, talking a little bit more about the cancer burden, there is a strong scientific evidence of a causal relationship between alcohol use and multiple types of cancer, including cancers of the head and neck, mouth, esophagus, liver, breast, and colon. Worldwide, up to about 30% of the disease burden due to specific cancers in those over 50 years old is attributable to alcohol. And these burdens just are not widely known. Next slide. A major impediment to public health-oriented alcohol policymaking is the public perceptions around the benefits of alcohol consumption. Despite substantial evidence that alcohol is a determinant of poor health, some older studies have suggested that some moderate alcohol use in some populations of men may be associated with a lower risk of heart disease. These early findings have distracted from clear messaging about the public health risk of alcohol. And more recently, in light of new findings that link cancer and alcohol use, some countries have begun to tighten their guidelines around drinking. Next slide. I want to call out a couple of countries who've gotten right and been able to reduce their burden. Recent research shows these policies have reduced alcohol consumption across Ireland. They've been able to embark on minimum pricing there, on regulation of alcohol marketing and advertising, on health labeling, and enforcement powers for health officers to enforce laws on the sale, supply, and consumption of alcohol products and reduce death and disability. Next slide. Thailand's also done some good work. The Alcohol Beverage Control Act there bans direct advertising and promotion of alcoholic beverages and sets a minimum price for alcohol use at 18, which sounds normal in the US, but is really quite rare across the world, these minimum ages. The law also requires products to carry warnings that drinking can hinder the ability to drive, that they're bad for pregnant women, and that restricting alcohol sales should be, and they restrict alcohol sales to certain hours and days. Next slide. So what do we do? Well, alcohol consumption is a public health problem that requires a population focus. The best way to minimize the social and health harms from alcohol is to lower consumption overall. The death, disability, and injury burdens caused by alcohol are largely preventable. And we actually know what works to tackle the harmful use of alcohol. We just need to do it. Next. The three agreed most effective methods for reducing the harmful use of alcohol are now part of a technical package called SAFER, created by the WHO, World Health Assembly, with technical help from Vital Strategies. These include increasing excise taxes or using minimum pricing, enacting and enforcing restrictions on the availability of alcohol, and comprehensively restricting exposure to alcohol advertising, especially to young people. Next slide. I'm going to keep returning again to the lessons of tobacco because there are some things in tobacco control that have been very well studied, and we now know that they work for alcohol too, including some of those things we mentioned, like taxes, like raising the purchase age, like bans on marketing, like regulating the availability and insisting on clear package warnings or clear bottle warnings, often in cans. Okay, so what to do? Well, we suggest a three-pronged approach to reduce the burden of harmful drinking. Next slide, please. We would like to see civil society, one, advocate for high-impact policy solutions at the local, national, and international levels. We would like civil society to educate the public and policymakers about the health, social, and economic impact of harmful alcohol use and the need for policy. And we'd like to hold governments accountable for global and national commitments to reducing alcohol-related harms. Next slide, please. We'd also like to see governments comprehensively implement these WHO SAFER interventions and take the lead in implementing policies that reduce the harmful use of alcohol. Next slide. And we want the World Health Assembly and the United Nations to provide technical assistance to support national governments to strengthen their policies and regulatory approaches, and to provide regular and timely status reports on alcohol harm and alcohol policy developments. In fact, this year, a new global strategy for alcohol that will run from 2022 to 2030 is expected, and Vital Strategies is working on this. I'm very sorry I'm not with you in person, but I welcome your questions, so please feel free to get in touch with me through the conference organizers. Thank you very much.
I'm Nandita Murukutla, Vice President for Global Policy and Research at Vital Strategies. I'll be presenting today findings from our latest report, The Sobering Truth, Incentivizing Alcohol, Death, and Disability. Alcohol, like tobacco and fossil fuels, is a commodity that harms human health. We describe incentives that go towards unhealthy industries as perverse because financial incentives for these industries go against the fundamental interests of society. These are incentives going towards industries that harm health and harm societies, and therefore we consider them perverse incentives. In Sobering Truth, we describe findings from a narrative review that we just concluded on the financial incentives received by the alcohol industry. Harmful alcohol consumption is a major public health concern worldwide. In all continents across the globe, in high and low and middle income countries, harmful alcohol consumption is proving to be an epidemic. Each year, more than 3 million people die as a result of the harmful use of alcohol, and harmful alcohol consumption costs societies. For example, in the United States alone, 249 billion a year are lost in healthcare and other social costs. There have been a number of global commitments and pronouncements to address the harmful use of alcohol. Technical packages like SAFER describe a range of interventions that can be implemented to protect against the harmful use of alcohol in countries. These interventions include strengthening restrictions on alcohol availability, advancing and enforcing drink driving countermeasures, enforcing bans on advertising, sponsorship, and promotion of alcohol, and raising prices on alcohol through excise taxes and pricing policies. And yet, as we describe it in our report, the alcohol industry benefits from a range of financial incentives. These range from development assistance, tax breaks, tax rebates, marketing deductions, production subsidies, and incentives that are offered in the form of international trade agreements. Hence, on the one hand, there has been generally poor implementation of alcohol policies, poor implementation of the technical policies that are the policies that are described in the technical packages like World Health Organization's SAFER package, and yet we find evidence for governments giving economic incentives to a multi-billion-dollar alcohol industry. In our report, we provide a number of case studies that describe development assistance. For instance, since the 1990s, the European Bank for Reconstruction and Development has provided more than 422 million US dollars in development assistance for investment in breweries. And yet, many of the countries that are receiving this development assistance in Central and Eastern Europe face an alcohol epidemic. We describe examples of tax breaks. During the 2014 World Cup in Brazil, FIFA required Brazil to waive US 475 million in taxes on any profits made by FIFA and its commercial partners, including AB InBev. And yet in Brazil, binge drinking is reported by 51% of alcohol drinkers. We find evidence of marketing deductions, and this despite the fact that it is recommended that countries enforce restrictions on the marketing, promotion, and sponsorship of alcohol. The US federal government, for instance, provides marketing deductions, tax deductions for business expenditures, including on advertising and marketing. And we report in Sobering Truth how the top 10 alcohol producers in 2017 alone were exempted from paying taxes on 1.5 billion US dollars for beer advertising. And yet, between 1999 and 2017, alcohol related deaths more than doubled in the United States. We describe examples of tax rebates that are offered to the alcohol industry. In 2012 alone, the US federal government provided 230 million US dollars in tax rebates to Bacardi in Puerto Rico and 199 million US dollars in tax rebates to Diageo in the US Virgin Islands. And in all of these places, we find a significant alcohol burden, including binge drinking and rising alcohol rates. We report examples of production subsidies. In 2002, the Ugandan government offered production subsidies for local sorghum for beer produced by a Ugandan brewery of Sab Miller. And yet, Uganda has the seventh highest rate of alcohol consumption in Africa, and alcohol use is the leading risk factor for years of life lost in that country. We also report the international trade agreement practices that are used to benefit the growth of alcohol production. The UK government worked to remove pricing regulations on beer worth more than US 80 million in sales for Sab Miller. And in India, per capita alcohol consumption has been growing, as has been growing the societal and health costs from harmful alcohol consumption. And so, in conclusion, our report describes the number of incentives by which alcohol production and consumption is promoted. Incentives most often go to companies that are multi-billion-dollar corporations themselves with headquarters in high-income countries. And this is the case even as countries struggle to meet their health needs, they are finding health harmful commodities continuing to be promoted. And so, in conclusion, we call for policy coherence to prevent NCDs. Our report describes how fiscal policies are crucial to prevent NCDs, and phasing out incentives to promote products that harm, phasing out incentives that promote health harmful products is crucial while investing in social programs. It's crucial to make fiscal policies and finances work to prevent NCDs. Our report is available at this website, and we're available to answer any further questions or requests for information. Thank you.